Hello, my name is Dr. Peter Newen from Image Plastic Surgery. I'd like to talk to you today about bony facial contouring. Even though bony facial contouring is performed in the Caucasian communities, it is not as prevalent as it is in the Asian communities. The presence of high cheekbone, prominent jawline, as seen in Angelina Jolie, which everybody considers very attractive, it is not a desired feature in the Asian community in general. If you have a chance to look at some of the Asian celebrities, for example, if you see Korean dramas or Asian movies, you will find that the vast majority of the celebrities have a V-shaped face or an oval facial contour. In patients who have rectangular or squarish face, they usually involve two procedures. One is to reduce the cheekbones, and the other is to reduce the mandibular angle. In patients who are candidates for this surgery, I usually recommend that they obtain a 3D cone beam CT scan. The 3D cone beam CT scan will allow us to see the bony facial architecture, and it allows me to help explain to the patient what area of the bone we will be reducing. The surgery is performed under general anesthesia. The vast majority of the incision is performed inside the mouth, with very small access incision performed externally. And these incision sites usually heal almost invisibly. This is the zygoma. On this skull, this zygoma is very normal in appearance. But in patients who have prominent cheekbone, it is bowed out a lot more. During the surgery, what we would do is cut on the anterior part of the zygoma and green stick fracture the posterior part of the zygoma to allow it to lie flatter. And if this bone is flatter, then the upper part of the face will look smaller. And on the mandibular angle, what we would do is cut a portion of this angle away. And this is where the 3D cone beam CT scan is very important. Because if you look on the back part of the mandible, you can see that there's a notch right there. That's where a very important nerve enters the mandibular body, and it exits right here. And if that nerve is injured during the surgery, the patient can have significant problem after the surgery. If we perform the 3D CT scan prior to the surgery, we will know the exact position of the nerve and able to plan the exact amount of bone reduction. After the surgery is done, the only side effects that the patient will have is in general facial swelling and maybe some bruising. But when all the swelling and bruising has gone away, what the patient can experience is a very markedly contour improvement of their face. Let me show you a patient of mine who has this procedure done. And you can see that before the surgery she has a very rectangular and squarish kind of face. And after the surgery is done, you see the cheekbone is in and the jaw angle is in. And you can see the effect. Her face changes from a very rectangular shape to a much more oval and much more attractive appearance.